I'm Rob Carnahan. I'm the CEO of Banner Churchill. I've been the CEO here now for 7.5 years. And gosh, I've got to see a lot of great events happen at Banner Churchill and for our community, and events that really impact our health and our safety and keeping everybody well here in our community. It's a passion for all of us at the hospital for that commitment. We're driven for that. We're just so excited for all these type of events. A few years ago, we did the opening of the ED, and we had the big ED opening, a $10 million investment from Banner Health into our community, which I think it's extraordinary. If you saw our ED before, it was like a little small. We were putting people in closets, so that was a big thing. We have a 16-bed ED now, which is a great thing. This is another one of those examples. I've been talking to a few of you today, and one of the couple big words that I've already heard is, this is a big deal day. So this is a big deal day for us. And we are so excited. Again, this is another opportunity for us to save lives more quickly. And this team that we have here is just so incredible. There have been so many people that have made this happen, from our board, our foundation, our auxiliary. There's just been so many key people that have been involved in making this all happen. We've been talking about this. Lynn, how long have we been talking? 5 years. So we've been talking about doing this for 5 years. We're like, let's just build a new building. And we looked at that, and it's very costly to do that. And then Tracy and Alan, they came up, these two wonderful human beings, presented this to Mike Burney and our board and said, hey, we got this great building that's available. And we came over here and looked at it, and it made total sense for us to come in here and take advantage of this site, the place where this is located. A lot of the community lives out on the west side, so we just want to make sure we can get to those places from our EMS team to get to those places really quickly. Our EMS team is second to none. These guys have made such an impact, and they're so dedicated to this community, and they're so good. They're training. You should see. They have a new training center up here. They are constantly training all the time to make sure that they remain at their best and being able to take care of everybody in the community. Could be me one of these days, so I would trust any of these folks to do that. So, all right, I was told I got 2 minutes, so I'm going to shut up right now. But I would like to invite some key people up here. I'm going to start with Steve, but I'm going to have a couple other people come up because I think it's really impactful to hear from some of the other people who have made this happen as well. So I'm going to invite our friends up here, Penny from the auxiliary. I'd like to invite Rick Pierce from our board. I'd like to invite Joanna Dean. She's our foundation coordinator. I'd like to invite the Mayor Tedford. I'd like to invite the Mayor Tedford up here. So, okay, that's my 2 minutes, maybe 3. But Steve, you got this.
Okay. Thank you, Ron. Thank you very much. One of the mantras of Banner Health is leadership matters. We're standing here today as a testament to that leadership truly does matter. None of this is possible without everyone's involvement. The leadership from Rob, from Brittany, Dr. Aiken, the ones that oversee the operations of EMS, our board, our auxiliary, our foundation, Mayor Tedford. None of this is possible. Our auxiliary, you saw the side-by-side, the equipment that they've purchased for us. So there's many people that are responsible. Mr. and Mrs. Harris, Alan Harrison, and his wife Tracy. Beautiful facility. Thank you for welcoming us into your facility. This is just an amazing, amazing project. There's so many people I could thank, but I know I'm limited on time as well. Any husband would be remiss without thanking their spouse for not killing me in my sleep for many restless nights, and I've kept her up for the details. So there's so many people, but we would not truly be here today if it was not for the men and women of Banner Churchill EMS. They are second to none. Through COVID, through short staffing, through everything that can be thrown at them, they're just the most amazing, resilient bunch I've ever had the honor and privilege of working with. So thank you.
Okay, Brittany, you got to come up here too. Brittany Hurt is I'm a nurse, and I was a CNO here when I first got here. Brittany Hurd she is just such an amazing nursing leader and operational leader. But we're glad to have Brittany here as well. So here's what we're going to do. Penny, and would you like to say just a few words from the auxiliary perspective?
Yes. The Banner Hospital Auxiliary is 55 people. We have 3 different sections. We have the greeters that come into the hospital, that greet you when you come into the hospital. They generally see about 3,500 patients a month. We have Rainbow Treasures gift shop in the hospital, and we have Stuff and Such thrift store over on Nevada Street. This year alone, we've donated $155,000 to Banner, as well as $18,000 in medical scholarships to students that are going into the medical field, high school and college students. It's a real pleasure to look in the garage and see the truck that we donated in 2019, as well as the side-by-side and trailer that we did last year. So we are committed to supporting Banner and our local community.
Wow.
Joanna, you ready?
I'm ready.
All right, Joanna, Dean, Foundation Coordinator.
The Churchill Community Hospital Foundation is so excited to be part of this. This is one of the things we work for every day, helping our community, helping support our community, helping health and wellness. We also do help patients by giving grants when they're in need. We also provide nursing student scholarships. And again, we're working towards raising funds for big things like this. Thank you. Thank you.
Lynn, you ready? Yeah. Okay. All right. Lynn Pierce, he's our chair and president of our advisory board.
So I can remember back 1990 or so when the original hospital takeover after the other hospital left town in the dark. And we had a great group of people who stepped up and started it. I remember we were excited because we got some new ambulances thanks to the tax override that the community supported that got us Churchill Inc. A start. Mike and I, Chairman Emeritus Bernie over there, we're I believe the last original members of Churchill Incorporated. You know, 5 years. We talked about this 5 years ago and started looking, and I shouldn't be surprised that it took that long, but literally the 2 people that most made this happen were Alan and Tracy. Without them, none of this would have been possible. And as I've got the tour, my guide talking to me about the 47% reduction in call times because of this. It's not just a convenience, it is going to save lives for this community from now and for years to come. I'm just glad to be part of it.
I don't even think I need to introduce this guy, but Mayor Tedford.
First, I'd like to thank you all for coming out today. And I'd like to tell you that no one said I was limited on time. just Rob, I guess, for 2 minutes. My time started on the board in 1981 when it went from a public hospital to private in a time of a real community upheaval. I never would have dreamed that day that we'd be sitting out here today with a second station for ambulance. I can tell you 5 years ago when Steve first made a presentation to the board about call times and how it took 12 to 15 minutes to get out here and the amount of people who were served out here and how much quicker healthcare would be if there was another station on the other side of town. That really got this started. and the board was real receptive, I think, that day. And so I think a lot of real credit goes to how well his presentation was that day, of the facts and figures and numbers that proved how necessary this was. So I just have to really give a real, I guess, a shout out to Steve for his presentation that day that proved the necessity. And then I think to Tracy and Alan for being receptive to what I felt was a perfect place, and the board did, for this to be located. No question that healthcare in Churchill County and the city of Fallon is great, and that we're all very proud of it. We thank not only EMS services, but services inside Banner, and how great they are, and our community served. It's just more served well, I would say, today with the opening of the station for the entire community. And I'm thankful very much for it, and very proud to be a part of it today here at Station 2 for the ambulance services. So once again, thank you all for coming and showing your support for not only EMS but the hospital itself, and also for our community. And thank you to the Harrisons for helping work this whole thing out. Thank you again.